Pregnancy Week 29. At 29 weeks pregnant, you are in your third trimester, which can be exciting and overwhelming. This stage brings significant physical changes, emotional shifts, and important milestones. As your baby grows, you may notice more distinct movements, such as jabs and kicks, which might soon transition to rolling sensations as space in the womb becomes tighter. Your body adapts to support your baby's needs while preparing for labor and delivery. Week 29 Pregnancy Ultrasound. An ultrasound is usually performed at 29 weeks of pregnancy only if there are specific concerns, such as monitoring the baby's growth or examining the placenta. If you have an ultrasound this week, you can expect to see the baby's position, whether it's head down, breech, or transverse, and observe movements like kicking, stretching, or even thumb sucking as their motions become more coordinated. Advanced imaging techniques, such as 3D or 4D ultrasounds, may be used to showcase the baby's facial features, including the nose, lips, and cheeks. Key organ development, such as the brain, kidneys, and stomach, will be evaluated. The baby's heartbeat will be assessed and typically ranges from 110 to 160 beats per minute. Amniotic fluid levels and the position of the placenta will also be checked to ensure proper blood flow. Measurements, including head circumference, abdominal circumference, and femur length, help estimate the baby's weight. Week 29 Size of the baby. At 29 weeks pregnant, your baby is roughly the size of an acorn squash. At this stage, the average fetus measures about 15.2 inches long and weighs approximately 2.5 pounds. Week 29 Baby's development. At 29 weeks of pregnancy, the baby is experiencing rapid development, gaining muscle and fat, and their skin is beginning to smooth out as they grow stronger. Movements may shift from gentle flutters to more pronounced kicks, stretches, and hiccups, which indicate the formation of connections between the brain and the diaphragm. Your baby's bone marrow produces red blood cells that deliver oxygen and remove carbon dioxide from body tissues. Initially, these cells were made by the yolk sac, then the liver took over from week 7 until now. Your baby's bones are hardening as they absorb calcium, and a protective myelin sheath is forming around their nerves. While the lungs produce surfactant to assist with breathing, they still need additional time to mature before delivery. Your baby is losing the protective coating known as vernix caseosa, which helps shield their skin from amniotic fluid and aids in temperature regulation. Some babies may still have this coating at birth, while others might begin to shed it earlier. Your baby may have already turned their head downward in preparation for birth, although some may still be in a breech position. Week 29 Pregnancy Belly. At 29 weeks pregnant, many women notice that their bellies have become significantly larger as they embrace the third trimester changes. The uterus now sits about 3.5 to 4 inches above the belly button, creating a prominent baby bump. The shape of the belly can vary based on individual factors such as body type and the baby's position. Some women may carry more round and high, while others may have a wider or lower belly. Your fundal height, the distance from your pubic bone to the top of your uterus, should be around 29 centimeters at this point, typically correlating with the number of weeks pregnant. As the skin stretches to accommodate the growing baby, stretch marks may appear, especially on the belly, hips, and breasts. This stretching can also lead to itchiness, making it essential to keep the skin well moisturized. You may also notice a dark line known as the linea nigra becoming more visible, which runs from the belly button to the pubic area. This line usually fades after pregnancy. Many expectant mothers observe that their baby's movements are becoming more noticeable, with kicks and rolls causing the belly to shift or bulge. If you are expecting twins, remember there is even less room for movement inside your belly. You can monitor your baby's activity with a daily kick count, aiming for 10 movements within 1 to 2 hours. This routine can help you understand your baby's unique patterns. If you notice decreased movement, trying ice-cold water, playing music, or giving a gentle massage may help stimulate activity. However, if concerns about movement persist, it is advisable to consult a doctor. Week 29 Pregnancy Body Changes. At 29 weeks pregnant, a woman experiences significant changes as her body supports her growing baby and prepares for childbirth. By this stage, most women have gained approximately 19 to 25 pounds, influenced by the baby's weight, placenta, amniotic fluid, increased blood volume, and additional fat stores for breastfeeding. As your baby pushes against your lungs, you might experience breathlessness and frequent bathroom visits, especially at night due to the pressure on your bladder. Breast development continues, with breasts becoming heavier and the early production of colostrum sometimes causing leakage. Mild swelling in the feet, ankles, and hands is typical due to fluid retention and increased pressure on veins. Proper hydration and comfortable footwear can help alleviate this discomfort. This stage can bring mood swings due to hormonal fluctuations, along with a strong nesting instinct as the mother prepares for her baby's arrival. It's essential to monitor for signs of complications, such as sudden swelling, persistent headaches, regular painful contractions, reduced fetal movement, or any vaginal bleeding or fluid leakage. If any of these symptoms occur, contacting a doctor is advisable. Week 29 pregnancy symptoms. 1. Hemorrhoids. Increased pressure from the growing uterus can cause swollen veins in the rectal area, leading to discomfort or bleeding. 2. Varicose veins. The additional weight and hormonal changes can lead to enlarged veins in your legs, causing discomfort or a feeling of heaviness. 3. Braxton Hicks contractions. These practice contractions may start to occur, characterized by tightening of the abdomen, helping your body prepare for labor. 4. Trouble sleeping. The growing belly can make finding a comfortable sleeping position increasingly difficult, leading to restless nights and fatigue during the day. 5. Anemia. Some women may experience a decrease in red blood cells, which can lead to symptoms like fatigue, weakness, or shortness of breath if not properly managed. 6. Weird dreams. Hormonal changes and emotional fluctuations can lead to vivid and sometimes strange dreams, which can leave you intrigued or puzzled upon waking. Week 29 Pregnancy Checklist. 1. Learn about third trimester tests. Research the tests and screenings for the third trimester, and prepare questions for your OB or midwife to clarify what to expect at your next appointment. 2. Schedule a tour of your birth facility. Visit your chosen facility to familiarize yourself with the environment and feel more comfortable for delivery. 3. Think about a baby moon. A short getaway before your baby arrives can be a wonderful way to relax and spend quality time with your partner. 4. Check baby shower registries. Look for recommendations from other parents to find well-reviewed essential items for you and your baby. 5. Prepare your baby's nursery. Set up your baby's nursery with essentials like a crib and clothing to feel ready for their arrival. 6. Prepare your body for labor. Strengthen your body with exercises like squats for lower body strength and pelvic floor exercises, such as Kegels, to improve muscle tone for delivery. 8. Choosing a childbirth class. Consider childbirth education classes to prepare for labor, delivery, and early parenting, providing valuable knowledge and support. Week 29 Pregnancy Tips. 1. Increase calcium intake. Your baby's bone health needs to include more dairy products like yogurt and cheese, or plant-based sources such as leafy greens, almonds, and fortified beverages in your diet. 2. Rest your feet. Pregnancy can cause swelling, so take breaks to elevate your feet. This helps ease discomfort and improve circulation. 3. Prioritize breast care. Nurture your breasts as your body changes. Use moisturizers to prevent dryness and maintain skin elasticity, and wear a comfortable, well-fitted bra for support. 4. Decide on baby's cord blood. Educate yourself about cord blood banking options and decide if you want to bank or donate your baby's cord blood for future medical use. 5. Adopt a high-fiber diet. Include fiber-rich foods like fresh fruits, colorful vegetables, whole grains, and natural laxatives such as prunes and bran to support digestive health. 6. Stay hydrated. Aim for 10 to 12 cups of fluids daily to stay refreshed and support your body's needs during pregnancy. For more videos like this, please like, share, and subscribe.